Hi guys, my name's Sanjay Gupta. I'm a consultant cardiologist, and today I wanted to talk about a subject about which there's very little information, but it's something that a lot of people ask and they don't understand. And I've actually tried to do a lot of research to try and find out good explanations for why some people get more ectopics in certain postures. And actually, there's very little information out there. So I've had to go back and look at some research papers done in healthy adults to try and understand this. The first thing to say is that some of these postures that bring on ectopics, we all adopt these postures, but we don't all necessarily feel the ectopic. So there are two components to it. Okay, the first and the foremost is that as someone who feels the ectopics, there is an issue about sensitization, i.e., because you've felt ectopics before, you are more likely to feel them. So you're going to be more aroused to more ectopics or feeling ectopics, okay? And the second thing is that there may be things that you're doing with that the posture is doing, which increase the propensity of ectopics. So there are two components to this. If you are someone who knows what an ectopic feels like, you are more likely to feel ectopics. But it is also true to say that ectopics can occur more frequently in certain postures or certain positions, all right? And so it's worth bearing that in mind. The second thing to say is that largely posture affects the autonomic nervous system, and it is the effect of posture on the autonomic nervous system which causes the ectopics, causes an increase in ectopics. Now, what is the autonomic nervous system? It's a system which consists of two individual systems, the parasympathetic system and the sympathetic system. And these are the two systems that regulate the heart rate, okay? Now, we are all familiar with the sympathetic system, which is the flight or fright response. So, for example, if you're walking along in the middle of the night, someone jumps out at you, immediately a ton of adrenaline goes in your body, the adrenaline stimulates the heart starts beating really fast, you get into that flight or fright response, and that makes the heart rate go up. Now, there is the opposing side, which is the parasympathetic system. So whilst everyone knows about the flight or fright response, what they don't know is that there's something called the rest or digest system, which is the parasympathetic system. So once the heart rate goes up from the sympathetic, the parasympathetic brings it back down, all right? Similarly, when you go to sleep, the parasympathetic goes up, i.e. your heart rate falls. You are in that rest or digest phase, the heart rate falls. And then when you get up in the morning, the parasympathetic goes down and the sympathetic goes up to prepare you for the day. So you get more adrenaline, etc., in the body. So an imbalance of the sympathetic or the parasympathetic can all cause ectopics. So why? If you have an excessively active sympathetic system, i.e. you have a lot of adrenaline, etc., floating around in your body, then you are more likely to get ectopics because adrenaline is a stimulant, okay? So your heart is going to beat fast, it's going to make your heart a little bit more irritable, you'll have cortisol, all that kind of thing makes the heart a little bit more irritable. So those are the people who get a lot more ectopics when they get very anxious. Say they have had a big argument with someone, say they're having a very stressful day at work, and they start noticing the ectopics a lot more. In fact, I was speaking to someone the other day, and they said, well, I get the ectopics when I'm getting ready for work. You know, I'm fine at night, and in the morning when I'm getting ready, I start noticing these ectopics. Well, in that patient, clearly the reason for the ectopics is this excessive sympathetic drive. Either it's excessive sympathetic drive or it's just normal sympathetic drive that they're feeling more excessively by feeling the ectopics because they're sensitized to the ectopics. Then there is another type of patient who has this parasympathetic or vaguely mediated ectopics. So some people have this thing called vagal ectopics. And in them, what happens is that the parasympathetic nervous system is more active, and the parasympathetic system is the rest or digest. So it brings the heart rate down. And because it's bringing the heart rate down, the heart rate, the gap between each individual heartbeat gets longer and longer. And that allows more ectopics to happen because there's more room for extra beats to come in. And those are the people who will notice it mainly at night, when they're lying down. They lie down, they start then feeling it. And even athletes, very competitive, highly trained athletes will get this kind of vagal ectopic. Some people relate it also to their digestion, and they say, well, when I'm feeling bloated, or when I'm lying in bed and I've had a big meal, I get these ectopics. So it's important to note that it's a balance between the sympathetic or the parasympathetic. Some people get it because of sympathetic hyperreactivity. Some people get it because of the parasympathetic side of things. Now, what posture does is it affects the sympathetic or the parasympathetic system. So here are a few postural things that people complain of when they get ectopics. So a lot of people say, well, when I lie down at night, I start getting them. I'm fine when I'm sitting up, I'm fine when I'm walking, but as soon as I start lying down, getting ready for bed, I start noticing them. Well, lying down is in keeping with the rest and digest system, because it's a posture that is associated with rest. So the parasympathetic nervous system becomes more active, and therefore the vagus nerve gets more active. The heart rate begins to slow down. And that's why you tend to get more ectopics when people lie down. Everyone gets more ectopics. However, some people will notice them more. All right, not everyone notices them. So you have to have that hyper arousal as well. You have to, and that's why a lot of anxious people who are very sensitive to what's going on with their heart, notice it a lot more when they're lying down. Then some people say, well, I notice it more when I'm lying on my left side. And I was thinking about this. Why should you notice it more on the left side? Well, again, lying on the left is a vagal thing, not but equally well, what tends to happen is when you're lying on your left, the heart actually lurches forwards. It comes forward, comes closer to the chest wall. And we know this because when I do echocardiograms, ultrasounds of the heart, I actually lie people on their left side so that I can see the heart much more clearly, because the heart falls forward. And that's another mechanism why which people who lie on their left side will notice more ectopics. So that's okay, but then why should people who lie on their right side sometimes feel more ectopics? And I often get people writing to me and saying, well, why do I get more ectopics when I'm lying on my right side? And I looked this up, and there was a nice study by a group called Chen and Kuo. Okay, and this was, I'm just trying to find it for you. And they published a paper in a journal called Anesthesia in 1997. I'll put the link at the end of this. And that was called The Effect of the Lateral Decubitus Position on Vagal Tone. And what they found was that the position in which vagal tone was the highest was in the right side. Lying on your right side is the most vagal position you can be in, and that's why people with vagal ectopics, okay, will notice it a lot more when they're lying on their right side. So if you're noticing it more on your right side, it may be an idea just to turn your position, or even lift the head of the bed slightly if you can. So, and then they should get less frequent. Okay, now there is no paper which says this, so I'm just postulating this, and I'd be very interested in finding out whether this works for you or not. Then there's another position which a lot of people write to me and say, well, why do I get it in this position? And that position is bending forwards. If you're bending forwards or leaning forwards, or sometimes even squatting, people can get a lot more ectopics. And the answer to this is this. that when you're bending forwards, you are increasing the pressure inside your chest because everything is compressing. You know, everything is compressing, and therefore the pressure inside the thoracic cavity goes up. And what that means is that all the veins get all the veins in the lower half of the body get emptied, and everything and the amount of blood returning to the heart increases. All right. And because the amount of blood that comes into the heart increases, initially what happens is the heart is beating at its normal beat, so the blood pressure goes up. But subsequently, if you maintain that posture, what tends to happen is that the heart slows down to keep the blood pressure the same. Because remember, the blood pressure is dependent on the heart rate and the resistance. And if the resistance has been increased because you are bending, then the heart rate has to decrease to try and keep the same blood pressure. So whilst there's a slight overshoot in the blood pressure initially, the heart then starts slowing down. So in essence, bending over or squatting has a vagal effect. The heart starts slowing down. As the heart slows down, the gap between each heartbeat increases, and because of that, you have an increased tendency for extra beats to come in, and that's why people get it more when they bend. All right. And those are the reasons why some people get these postural ectopics. I hope that makes sense. I'll put some links at the end of the video or at the bottom of the video. But I think that's the reason why some people get ectopics. Now, what you should try and work out is, are you someone who has vagal ectopics, who's getting ectopics because of overactivation of the parasympathetic system, or are you someone who's getting these sympathetic ectopics, which are due to adrenaline, etc.? And the way you'll know is because if you're getting them in response to, you know, going to work, being very stressed, etc., then you're someone who will benefit from things which activate the vagus nerve, i.e. increases the parasympathetic system. So what things affect the vagal nerves? Well, you may recall I put in a breathing exercise recently, which helps a lot of people. So for those people, that kind of thing works. Then there are those people who have vagal AF. In those people, you'll find that they actually get it more at night. They get it more sort of, when they're resting. They get it more when their stomachs are bloated. And actually, when they're working or exercising, they don't get so much. And so in those people, it may be worth just lifting the head of the bed, if you can, to try and reduce this vagal effect. And maybe that will work. I'd be interested in seeing whether any of this works for you or not, but please do let me know. So I hope that was helpful. My name's Sanjay Gupta. I'm a consultant cardiologist. Okay, and this is my website, and this is my Facebook page. So if you have any questions, please don't hesitate. I really appreciate all the great great comments and the great feedback. And please keep sending me your comments, and I'll try and answer any questions you may have. Thank you so much. Take care. Bye.